are you feeling today?
My mother was born in Jakarta, Indonesia in 1931. She remained there until 1942, ended up in various parts of Europe for a number of years. From there, she built a wonderful life here in the United States. We moved her into initially kind of a senior living apartment building, so there wasn't any assistance, but she was fine there for a while. And then we noticed it was time that we probably needed to move her into a facility that had a little bit more help for elderly folks. On December 18th, 2014, I had gone to work, as I normally would. I usually get to work around 6:30, and I just happened to be walking to my office, and I checked my cell phone and saw that I missed a phone call from the nursing home. They had tried to call me at 5:30 in the morning, and I'd missed that call. And so I called them back. You know, the first thought I had was, this isn't good. Why is a nursing home calling me at 5:30 in the morning? And because my mother had been in the nursing home for so many years, my first thought was that she passed. But when I called them back, I was connected immediately to a nurse who had told me that my mother had been sexually assaulted. You know, one thing that was horrible in the emergency room was watching her hooked up to an IV, and her Alzheimer's was far enough in progression that she couldn't swallow very well, so they couldn't give her any oral medication. So that was heartbreaking, watching her be stuck with pins and needles because, you know, at 83 years old, they wanted to make sure she didn't get a sexually transmitted disease. And after this event, we noticed that she was banging quite a bit on her private parts, trying to tell us something with, you know, tears rolling down her eyes. And the heartbreaking thing was that though she couldn't move a lot, I had seen that motion before. But it wasn't until we knew what had happened to her and that we knew that she had been raped that I kind of put two and two together and realized she could very well have been trying to tell me this for months. And so to have assured her that she'd been safe, that she'd be safe, only to have her raped. How do you ever forgive yourself as a child? That you made that promise that she'd be safe and she wasn't. And my mom was always a very dignified woman and you know, such a wonderful, beautiful soul. And this event just stole any dignity she had left. It's just so inconceivable that somebody would do this to an 83-year-old woman who can't speak and can barely move. It's just not something you ever expect.
It is a crime for a caregiver, staff person, or anyone employed in a care facility to engage in sexual contact or penetration with a resident in the facility.
The sexual abuser preys on the individual that can't say something, that can't call attention to the fact that they've been abused. So we look for soft signs of abuse.
Soft signs of abuse is any time that you see a resident changing from how they were behaving before. Pay attention to why are they doing it that way. We do this with our pets, we do this with our children. They maybe can't put words to it, we go, something's wrong.
We're also looking for staff who are territorial maybe with a resident. They volunteer to always care for that resident. They volunteer to care for that resident behind a closed door. And maybe they're in there for an excessive period of time. Is there a specific caregiver that continually wants to provide care? And then are they making choices for timing or interventions that are different than the normal for that resident?
A particular case that comes to mind is where a caregiver was leaving the wing that he was assigned to and going to another wing of the facility and providing shaving services for this male victim in the middle of the night. That was a red flag to other people in the facility, and ultimately he was caught as someone who was sexually abusing that patient.
For instance, if a staff member comes out of a room and they're adjusting their clothing, they're tying their pants, they're buttoning their shirt, any of those kind of things are clues that something has happened that shouldn't have happened.
There's all kinds of boundary violations that can occur. It can be standing too close to somebody. It could be flirting. It could be using endearing names to a resident, calling somebody honey, that sort of thing. It can be bringing in gifts.
Maybe there are interactions that we see with a staff member or a resident where they're always together, or maybe they always have an arm draped around them, or maybe they're always complimenting them on how they look, on their clothing. We need to be aware that those are indicators that maybe there's an unhealthy relationship there, and that unhealthy relationship could be a sexual abuse relationship.
The Vulnerable Adult Act of Minnesota includes provisions that state if you are employed by a licensed provider, you are a mandated reporter. A mandated reporter must report any suspected abuse, neglect, or exploitation. It's the law. And there are penalties, possible criminal charges that can be brought against someone who had the responsibility to report but did not report.
We start by believing victims, and it's up to law enforcement or whoever to do the investigation to say it's not true or that it didn't happen. But our role as advocates is always to believe victims.
Do not assume that if you do not report, someone else will do the reporting, because someone else must have seen that happen.
I would rather that I investigate 99 times and find out nothing happened than to miss that report where something really happened.
Housekeeping may see something that doesn't look right. It doesn't matter where you are on the hierarchy, if you will, of a long-term care facility as an employee. If you see it, report it.
Don't think that you have to prove something is wrong. You just have to have a suspicion, and then you follow up on your suspicion. That is going to provide safety for the patient as well as the institution.
So if you really believe in caring about them, it's in your best interest to report that. It goes hand in hand. If you care about them, you want to report it so in that way they are protected. And that's our main goal. By doing the MARC report, notifying law enforcement, you are protecting them.
If your employees are fearful of communicating information to you, if they have fear of their fellow staff members, that they can't report something for fear they'll be retaliated against, if they have fear of the management staff not believing them, if they're silent about the needs of the resident, there can be an undercurrent of abuse.
The culture of silence also is created because sometimes, let's say it's a resident, they don't necessarily believe that anybody's going to do anything about it, or they're afraid that they won't be believed. Address the culture of silence by empowering employees, first of all, to feel comfortable reporting to people who can get something done about situations.
If you can operate every day, I am the guardian, I am the voice, I am the eyes and the ears for all of the 100 residents in my building. If every staff took that motto and lived it every day, we would have much fewer instances of abuse, neglect, or sexual exploitation.